It's another day, the sun is shining. Got to know what's going on around you. Wake up, it's the time to motivate your mind. Come with me, let's make this moment brighter. Wake up with the Bahamas at sunrise. Come on and wake up with the Bahamas at sunrise. Wake up with the Bahamas at sunrise. Wake up with the Bahamas at sunrise. Hey.
Good morning and welcome to Bahamas at Sunrise. I'm Anastasia Palacios. Happy Monday to you.
Happy Monday indeed. Good morning. I'm Philip Simon.
And of course, it's our pleasure to be with you on this marvelous Monday. We hope that you're looking forward to a great week and a great show. We've got one lined up for you. Before we go anywhere, I wished her a happy birthday on Friday, but since yesterday was her birthday, I think it's an appropriate time for me to say belated happy birthday to my princess Cairo, who turned 4 yesterday. And to all of those that are still celebrating, happy birthday to all of you.
No doubt. Happy birthday, Cairo. My aunt celebrated on Friday past. I wrote it down and I still forgot to say happy birthday to my favorite aunt. Well, I should say one of my favorite aunts. And disclaimer, I say that to all of my aunts, that they're my favorite aunt. Laverne Nixon, Martha Nixon. I think she's off and celebrating this entire week. Happy belated birthday.
And a very belated happy birthday to my good Frankie or Benaby as well, who celebrated on Saturday. So yes, September is the busy time. When I was having Cairo in hospital, they told me, that, things happen. This is a very busy time for us. All of the babies, that were beautifully created between Christmas and New Year's are all born between September and the first week of October. So this is our busiest time. And so whenever I hear all of the September birthdays, I'm like, yep, Christmas.
We call it New Year's. I bet it was New Year's, but I won't go any further than that. Interesting, very wet weekend, Star. I must admit, I did not pay attention to Godfrey on Friday past, and I was confused as to where all the rain came from. It was just amazing to see. My yard is actually still flooded, but you know what? Showers are blessings, right?
Yeah, indeed. Unless you have a 4-year-old with birthday plans. But we do the best we can. And the weather is what it is. This is around the time that we get spring tides. This is a tropical climate. This is why storms tend to be worse in September. And so, it's beautiful for creating lush beaches and gorgeous vegetation, but that comes with some rain. And I think it's a metaphor for us for life, that the rains are going to come, but they add to the beauty of the world around you. So we survived it. We adjusted plans, turned some things around, and we're still able to manage through the rain. But it was definitely a very wet weekend. Lots of flooding downtown, lots of flooding in the normal areas as well. And so, these are times when you recognize that there are some people celebrating their gardens, etc., are getting the nourishment they need. But there are people who have real challenges when these rains come, because it really does flood out their homes.
Yeah.
And so, of course, our thoughts and prayers are with them this morning as well.
Well, I was trying to put that glass half full, Star. We've seen the images of that over this past weekend. And, again, we send out our sincerest concern to our friends and our family down there south of us in Haiti. It's just an ongoing saga that just does not want to end, and it just will not end until we collectively, as the entire world, and particularly here in the Western Hemisphere, assist that country in getting back on its feet economically first. It's just so sad to see.
It's devastating to see what's happening in Haiti. 2 other things happening this weekend. So great speeches at the United Nations from our new Prime Minister, the Honorable Philip Brave Davis, and from the Honorable Mia Mottley out of Barbados, both calling out the United Nations as an organization, Mia Mottley in particular, for sort of failing the Caribbean and smaller nation states, those that would have joined after the initial 50 countries. And of course, our Prime Minister really going hard on climate change and the need for support. When we see Haiti, we know that the earthquake happened there a few weeks ago that would have been devastating, even more devastating than the fact that they have raging COVID numbers, no vaccines, and then to top it all off, economic conditions that have persisted for years since they were unfairly treated for the result of their own liberation, which is just facts. And anybody can choose to debate me on that. And so, yeah, it is a devastating situation. We pray for them, but we also pray for those in our southern islands who are now having to manage populations 2 and 3 times their size as the government works through repatriation and what is needed. And it just continues to be, as you mentioned, a challenge. So again, more thoughts and prayers needed, but also creative solutions on what we can do to help and more partnership across the regions to make those plans effective.
Yeah, no doubt, no doubt. But we've got a great show lined up once again for you today. We have an important discussion about education and the upcoming changes and development, and an interview with Dr. Pinto about prostate Cancer Awareness Month start.
I'm looking forward to both of those segments. Before we go further, I'm really excited to tell you about all of the free seminars that the TCL group is hosting this week. That's right, I said three seminars they're hosting this week. The first event is the Financial Voice World Tourism Day webinar that is being held this morning. Now that starts at 11 a.m. And this webinar will highlight specialists from various sectors that will contribute to the continuation of tourism. And then on Wednesday, September 29th, there will be the Demystifying COVID-19 webinar that features discussions from medical doctors and community leaders concerning the COVID-19 crisis. So we've got 2 seminars for you today, one today, Monday, the next Wednesday, all of it free. And of course, you can go to tclevents.com if you've not yet signed up but want to. Before we get into the show that Phil and I have promised is going to be dynamic and exciting, we're going to have a check on weather with Godfrey Burnside.
Weather at Sunrise, brought to you by Bahamas First. What's first for you comes first for us.
Bahamas, traffic Zuma, get out in Salvo this morning, and we'll trigger off pockets of showers and thunderstorms in the central and southeastern islands. But those showers becoming heavier times, so thunderstorms severe. Meanwhile, high pressure to the north of the northwest Bahamas will usher in dry conditions through Thursday over the northwest Bahamas. Today, partly sunny, hot and humid, chance of few showers or passing thunderstorms over northwest Bahamas, variable cloudiness with a few showers, isolated thunderstorms over the central and southeastern islands. High temperature reaching 90 degrees Fahrenheit, heat index 102. Tonight, we're looking at few clouds across the northwest Bahamas, partly cloudy and warm with a few showers and isolated thunderstorms across the central and southeastern islands. The low temperature going down to 74 degrees Fahrenheit. And some regional highs and lows across the Caribbean, Barbados 91 and 78. In Jamaica, 88 and 76. In Trinidad, 87 and 78. And the Turks and Caicos Islands, 90 and 74. Across North America, Atlanta, 79 and 56. In Raleigh, 81 and 58. In Miami, 89 and 76. Dallas, Texas, 89 and 67. And Toronto, Canada, 64 and 57. As you go the week, partly sunny skies, hot and humid over the northwest Bahamas. Still have some cloudiness across the central and southern islands into Wednesday. And then that weekend, another weak cold front should move into the extreme northwest Bahamas, and that will increase our cloudiness and elevate our shower percentage. Daytime temperature being in the upper 80s to lower 90s daytime and the mid-70s at nighttime. That puts you up on your first look at the weather sunrise. I'm Godfrey Burnside. Back to you, Star.
Thank you so much, Godfrey. Today in our Focus on Education segment, we are talking about creating educational opportunities through the transitions. Joining us from the Ministry of Education to discuss this, we're very happy to welcome Mr. Michael Culmer. He's a District Superintendent for Eleuthera, and Ms. Janice Moss, who's a District Superintendent for Western New Providence Primary. Good morning, Ms. Moss and Mr. Culmer, and welcome to Bahamas at Sunrise.
Good morning.
Good morning. Thank you.
Thank you.
It's a pleasure to have you both with us. And of course, we've been enjoying these segments, learning more about all the work that the ministry is doing. And today we really get to talk about what's been happening, the transitions of it all, and the opportunities to grow and learn together as a result of those transitions. So the first thing I want to get started with asking you both, and I'll start with Miss Moss, just no offense, Mr. Culmer, but sometimes ladies still have to go first. And so I'm going to start with you, Miss Moss, by finding out what educational opportunities arose during the transition through Hurricane Dorian and the COVID-19 pandemic.
Well, Anastasia, we moved from instruction from the brick and mortar to virtual classrooms. This necessitated the need for high quality internet services across the country so that our students would have equal access to the learning opportunities provided for them. And we created digital learning resources because we were no longer in the classrooms. We were now virtual. Everything was done online. And these activities were created for all subjects, for all grade levels across our educational system. Also, we already had a virtual learning platform, so we extended that to accommodate. In June, we had 400 users only, but by October, we were proud to entertain and to engage over 44,000 users in October 2020. Additionally, national timetables and pacing guides were created to reflect the various subject and learning modalities based on what the government mandated from advice from the health officials. And then there was extensive consultation with our partners, our internal and external partners, stakeholders, to ensure that the best strategies and also to ensure that what we wanted our children to learn and implement in our schools, that we had consensus from all major stakeholders. And I thought that was absolutely divine because we wanted them to be a part of this process. And the Ministry of Education, in conjunction with our private partners, we procured devices and internet services for students across the archipelago which meant that whether they were disadvantaged or if they were displaced, they still had access to quality education. And then we saw the establishment of our EMIS, our Education Management Information System, and our Learning Management System. They were established and utilized for monitoring and accountability. And so the Ministry of Education, we responded right away to minimize learning loss and to ensure that quality education was continued and every child in our country had access to this quality education.
Excellent, Ms. Moss. So a very thorough report there, all levels talking us through that process. And so congratulations to all of you on the work that you've done. I can imagine that as primary educators in particular, this has been different than for those in the high school system whose kids might be a bit more aware, who are doing things a bit differently. And so congratulations to you on that. Mr. Culmer, I know Eleuthera has had some differences in that there have been periods when they've been allowed to be in school, when those of us in New Providence were not allowed to be in school. So talk me through that. Were there the changes that you saw from your side or the opportunities you saw from your side the same, or were they a little different based on the island context?
Well, good morning and thank you again. When the Prime Minister would have announced on I think the 15th of March in 2020, that we were headed into emergency orders, our schools in Eleuthera mobilized almost immediately. What happened was there was the consultation between staff and teachers, and we were in a position where when the Ministry of Education spoke to the virtual instruction and the virtual learning platforms, we already had in Eleuthera our professional learning communities, and we had that set up digitally. And so it was easy for us to transition. We already had every grade level of our schools, the professional learning communities established. They were working the year before under Superintendent McPhee. And so that transition was that much easier. Now we were challenged to the extent where getting our teachers and getting parents and getting students using the virtual platforms, using the technical devices, having enough bandwidth and network, but through partnership, public-private partnerships. And we had some excellent partners here in Eleuthera, the Ministry of Education and others, and they ensured that devices and internet access was there for all. We had to do a lot of training. And of course, you know, change is always going to be met with resistance. And so we had to do a lot to win our parents and students and teachers and administrators over to the fact that we want to be a district of first choice. We refer to Eleuthera as district of first choice. In order to be a district of first choice, you have to be flexible, you have to be pliable, you have to be able to adapt. And those were the things that were required here in Eleuthera.
All right. So you talk a lot about adaptability and buy-in, also public-private partnerships, which we know are critical. And for you, Mr. Culmer, as we look toward the future, are there particular things that you are happy about, strengths and benefits that have come from this new system?
I'm glad you asked that question. We were asked a question as related to the gaps in the virtual education that we would have experienced, remote learning. And in order to answer that question in the Eleuthera district, we designed a survey. We surveyed 100 teachers in the Eleuthera district. And one of the questions in the survey was, what are some of the strengths of our remote learning? And I was amazed when I saw things coming out from there: greater parent participation, the ability to implement independent educational programs for students, whether they were at the lower spectrum of education and whether they were at the higher spectrum of education. One of the things that continued to pop up when we talked about our virtual instruction, we always talk about our high flyers. And sometimes we don't give them enough opportunities to excel, because we tend to focus on the middle. But with the virtual instruction and remote instruction, it was easier for our high flyers to work at their accelerated pace. We also discovered that many times the old way of teaching, the teacher was the center of knowledge. The teacher was the purveyor of knowledge and information. But in this new system, what we're simply doing is guiding our students and allowing them to determine at what rate they're going to learn. And the educational system became student-centered. And students now took control of their learning. And those are just some of the things. But
yeah, I'm sure there are many more, but those are some exciting ones to note.
Yes.
Ms. Moss, we do have to close out now, but before we do, what are some final words that you just want to leave with us regarding the new system, regarding your stakeholders in it? Any words that you want to just leave with us this morning as we wrap up this idea of the transitions between the COVID-19 and Hurricane Dorian storm, and what is new with the Ministry of Education?
You know, in this new dispensation, we have seen change in our educational system like we've never seen it before. Technology has propelled us to do things differently, and we have integrated technology in everything that we do in the how we collect information, data collection, analysis, how teachers engage students, and we are on the path, and this is going to continue. We, as a people, it showed how resilient we are and how we respond to crises. And at the Ministry of Education, I think that through our innovation and creativity, we are indeed an educational system that reflects one that will prepare our children for the future to come. We are very, very proud, and this is the vein in which we will continue.
Awesome. Well, congratulations to both of you. As leaders during this time, I can imagine that you had your own levels of stress to manage through and deal with, but to still be able to pull it off. And you know, I love the stat that Ms. Moss used earlier, going from 400 in June to about 4,400 or 44,000.
Yes, in October.
44,000 in October is just phenomenal. And
Yes.
I imagine that it takes a lot from the leadership side of this. And so
Yes.
we congratulate both of you. And we thank you for sharing with us on Bahamas at Sunrise this morning. We wish both of your districts all the best with this new school year. Thank you.
Thank you for having us.
Thank you so much for coming and updating us this morning.
You're watching Bahamas at Sunrise. We'll be right back.
First, it's more than just our name, more than just our achievements. It's our nature, and it's where we put our customers. At Bahamas First, we've refreshed our look, but our nature remains the same. We design insurance solutions that protect our customers from life's uncertainties, whatever they may be. We equip you for the future so that you can recover stronger. Bahamas First, what's first for you comes first for us.
Doctors Hospital is proud to introduce the Loyalty Advantage Membership Program, or LAMP. LAMP offers medical service discounts to new and existing Doctors Hospital patients. With membership starting as low as $20 per month, LAMP benefits include fee waivers for insured patients, discounts on inpatient and outpatient services, access to free imaging services, and much more. For a full list of benefits or to sign up for LAMP, visit doctorshos.com/LAMP. Doctors Hospital, trusted and best care now. Isn't your health worth it?
Our world has changed. Many businesses have been closed for months with little or no access to their customers until now. Rev Media can help you remain connected to your customers. Our trusted customized advertising packages and personalized consultants will provide your business with immeasurable support during this challenging time. Your customers are already watching. Rev Media can help you to remain connected. Call us today. Let us help you.
Welcome back to Bahamas at Sunrise. And again, back this morning, we have the good doctor himself, Dr. Greggory Pinto, urologist at Urology Care Bahamas, to talk with us once again about prostate cancer, and in particular, Prostate Cancer Awareness Month. Good morning, Doc. Welcome back to the show.
Good morning. Thank you for having me, Philip. Good morning, Bahamas. And I always have to say good morning to my daughter, Gia. Yes, September is in fact Prostate Cancer Awareness Month. Prostate cancer is an overwhelming pandemic that unfortunately is suffered in silence by hundreds of Bahamian men. We have the 14th highest incidence of prostate cancer in the world, and that's extraordinary. The number one cancer in this country is in fact prostate cancer, not breast cancer. Breast cancer needs all the awareness in the world. In fact, it even needs more, but we cannot forget our men. They're being struck down by prostate cancer many times in the prime of their life, and they're dying needlessly. 90 to 100 Bahamian men die every year of prostate cancer. Prostate cancer is a very treatable disease. In fact, if you can pick it up early when it's organ confined, when it's low risk, the cancer-specific survival is at 5 years is 100%. At 10 years is as high as 98%. So of all cancers, prostate cancer is probably the easiest cancer to treat. And it's a very big misconception that prostate cancer is a death sentence. In fact, it's the opposite. So we need to know our numbers. We need to know our PSA, our prostate-specific antigen blood test, starting at the age of 40. We need to start screening of prostate cancer in our men in this country at the age of 40 and getting a blood test every single year after that, so we can pick up prostate cancer early and we can give you an excellent cure. So the key to cure is early diagnosis.
Are there any hereditary issues, or who is more likely to get prostate cancer?
So unfortunately, because if you look at the Bahamian men, on the whole, we're primarily of African ancestry. One of the greatest risk factors for getting prostate cancer, not only prostate cancer, but a more aggressive form of prostate cancer that will strike men of African descent earlier than Asian or Hispanic or Caucasian. Advancing age is also an issue in terms of a risk factor. If we look at familial history, if you have a father, if you have an uncle, if you have a brother, that also puts you who had prostate cancer, that also puts you at a risk. Then we look, I mentioned breast cancer. There's a link between breast cancer and prostate cancer. We look at the breast cancer related gene, BRCA gene 1, BRCA gene 2. Men can get BRCA gene mutations as well. If you have BRCA gene 1 mutation, your chance of getting prostate cancer in your lifetime is 3 times greater than if you don't. If you have BRCA gene 2 mutation, your chance of getting prostate cancer is actually 8 times greater by the age of 70. So you're almost inevitably going to get prostate cancer if you have the BRCA gene mutation. So yes, there are a lot of factors that put us at risk. If you're obese, you're going to get a worse outcome if you get prostate cancer. If you have a very high alcohol intake, you also have a worse prognosis if you get prostate cancer. So unfortunately for Bahamian men, we tick all the boxes for high risk for prostate cancer, but the take-home message is modern urology involves minimally invasive treatment. That means you can get treatment on a Saturday for early disease. You can be back to work on a Monday. You don't even necessarily need your prostate cancer removed. You don't even need surgery. We can freeze the prostate cancer. We can use sound waves to heat and destroy the prostate cancer. We can put low dose or high dose radioactive seeds called brachytherapy to destroy only the prostate cancer cells themselves. You can get harmless radiation. So 30 years ago, yes, you unfortunately only had limited options for prostate cancer treatment, and a lot of it involved mutilating surgery that required a long recovery period where your erections were ruined. That's a thing of the past. We can do minimally invasive surgery if you want to have that as an option where we can spare the nerves, maintain your erections. You can have focal therapy where it's minimally invasive. In many cases, we can have outpatient management of your prostate cancer. And it can only be a little small bump in the road, and you can go on and have another 25, 30 years of good quality life on this earth.
Final question, Doc. Obviously you hear and you raise the concern all the time. Obviously it makes me reflect a little bit on my own father experience with it. What would you say are some of the symptoms? How would somebody even know that, besides, it being within your family, are there symptoms that persist?
Unfortunately, no. So that's why we have to be very diligent with screening. We got to start at the age of 40 and every year after that. I've seen men, in many cases, they relax, and for 3-4 years, they have no prostate cancer screening. And then in that period, that's where they're hit with prostate cancer and allow it to progress. So in the early stages of prostate cancer, there are no symptoms. When you do have symptoms, it's already too late. When it's spread, you developed constitutional symptoms, you're weak, you're nauseous, you're vomiting, you have back pain. That's when it's spread to the bones. That's when it's spread to the spine. That's when it's caused obstruction of the kidneys. Statistically speaking, if you're going to have urinary issues where you're going to pee frequently at night, where you're going to have a weak urinary stream, that almost with certainty, statistically speaking, is going to be related to non-cancerous, benign prostate hyperplasia, enlargement of the prostate, which every man is going to encounter as he gets older. That's just a part of getting older. 70% of men are going to have obstructive urinary symptoms because of benign disease. 80% of 80-year-olds are going to have that. So if you have the fear that because you're 55 and all of a sudden you wake up 4 times in the night to urinate, do not be fearful. More than likely it's because of benign disease. But if you're looking for symptoms, you're going to wait until it's too late. So that's why the message has to be clear. We need to screen you so we can pick it up early and you can have an excellent cure rate. And as I said, prostate cancer is a very curable disease.
All right. How can we reach you, Doctor?
I'm a consultant at Princess Margaret Hospital, so you can get a referral from any government clinic. You can get information with what I just spoke of from my website, Urology carebahamas.com. And my main office is Oak Tree Medical Center. The number there is 322-1145.
All right. As always, thank you so much, Dr. Greggory Pinto, urologist at Urology Care Bahamas. Thank you, Doctor.
My pleasure. Thank you very much.
All right. Thank you. You're watching Bahamas at Sunrise. We'll be right back.
Hi, I'm Dr. Warner Rogers.
Hi, I'm Dr. Rangan.
Hi, I'm Dr. Valencia Johnson.
Hi, I'm Dr. Munish Sharma.
Hi, I'm Dr. Jazreel Thompson.
Hi, I'm Dr. Bonami.
Hi, I'm Dr. Rajesh Pahawa.
Hi, I'm Dr. Therese Nairn Knowles.
Hi, I'm Dr. Alpheus Alec,
Director of Ambulatory Services at Doctors Hospital.
I'm the consultant surgeon here at Doctors Hospital.
I'm a pediatrician here at Doctors Hospital.
I'm the director of imaging at Doctors Hospital.
An anesthesiologist here at Doctors Hospital.
Infectious diseases physician.
I'm radiologist at Doctors Hospital.
Emergency room physician here at Doctors Hospital.
And I'm clinical director of the Emergency Transport Services and Continuing Medical Education here at Doctors Hospital.
I am vaccinated against COVID-19.
I have been fully vaccinated for COVID-19.
I am fully vaccinated against COVID.
I am fully vaccinated against COVID-19.
I'm fully vaccinated against COVID-19.
And I'm fully vaccinated against COVID-19.
I'm fully vaccinated against COVID.
I'm fully vaccinated against the COVID-19 virus.
I'm fully vaccinated against COVID-19.
I hope you are too.
Are you?
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 Welcome back to Bahamas at Sunrise. Thank you for joining us. We're at the halfway point on what we hope will be a marvelous Monday for you. I'm Anastasia Palacios.
And I'm Philip Simon. Happy Monday indeed. Star, every time I look at the promo, when we come back on and doing our little Twiddly thing, it's hard to believe that we've been doing this now for what, 18 months? When is the world going to get back together? When are we going to get back in the studio?
Yeah.
Some sense of normalcy, right?
Yeah, well, I think we may still be another year out, Phil. So we'll have to see what happens. I think now that the United States is going to make vaccination mandatory for travelers coming in as of November, we might see some of that change happen more quickly than we thought. People love Uncle Sam, Bahamians in particular. And so those who were hesitant, I think, might find themselves doing it, not because they want to, not because of personal choice, but because they need to get things done. And so as more of us are vaccinated here, I'm hopeful that we will see those mutations stop thriving and we're able to then manage better. But again, 6 to 12 months out, I still think we've got some time left in this space. But I miss you too, Phil. I miss you too.
Well, man, I've got so much I want to say about those mandatory vaccines that the United States is imposing upon the world. Sometimes you got to fix your own home first. But anyway, we're going to get into that another time because we've got more to come in our second half. We've got an interview with Dr. SinQuee Brown about Sickle Cell Awareness Month. That's also happening this month.
It sure is. And then we're going to finish out our show with Rupert Pinder and a discussion on the state of the economy. We've got all that ahead of you and more. But first, let's take a second look at weather with Godfrey Burnside.
Weather at Sunrise, brought to you by Bahamas First. What's first for you comes first for us.
Thank you, Stan. Good morning, Bahamas. In your second look at weather sunrise, your tropical weather update, we do have Hurricane Sam. And at 5 a.m. this morning, Hurricane Sam was located near latitude 15.2 degrees north, longitude 51.4 degrees west, some 1,290 miles east-southeast of the northern Leeward Islands. Winds are now down to 130 miles per hour. Is moving towards the northwest at 8 miles per hour. And then we have a surface trough associated with the remnants of Pinder, 700 miles southeast of Bermuda, has a 50% chance of regeneration over the next 5 days. And then we have a tropical wave expected to move off the west coast of Africa today, has a 70% chance of tropical cyclone formation over the next 5 days. And we have a broad area of low pressure, 700 miles southwest of the Cabo Verde Islands. This too has a 70% chance of tropical cyclone formation over the next 5 days. Elsewhere, tropical cyclone formation expected during the next 5 days. On the local scene, remnants of that old frontal boundary now across the central Bahamas as Exuma, Cat Islands, and Salvador, and that will trigger off some periods of showers and thunderstorms, and those showers heavy at times, so thunderstorms severe in the central and southeastern islands. Meanwhile, high pressure to the north of the northwest Bahamas will usher in drier conditions through Thursday over the northwest Bahamas. In your marine forecast, those winds today northeast at 10 knots or less, seas less than 3 feet over the northwest Bahamas, northeast to east at 10 to 15 knots, seas less than 3 feet over the central and southeastern islands. On Tuesday, those winds northeasterly at 10 to 15 knots, seas 2 to 4 feet over the Orly Islands. And then on Wednesday, those winds become variable 10 knots or less, seas less than 3 feet over the northwest Bahamas, east to southeast at 10 to 15 knots, seas 2 to 4 feet over the central and southeastern islands. Yeah, tides. Currently have a low tide at 6:26 this morning. Next high tide will be at 52 minutes past midday. Low gain this evening at 7:23. Sunset 6:59 this evening. Rising at 7:01. UV index 8. Your water temperature 83 degrees Fahrenheit. And the moon phase moving towards the last quarter. Extended look. High pressure will continue to dominate across the islands for the most part. Still that frontal boundary in southeastern islands. So we're looking at partly sunny skies, hot and humid over the northwest Bahamas. Still some cloudiness over the southeastern islands with some showers and possible thunderstorms. The temperature daytime will be in the upper 80s to lower 90s at daytime and the mid-70s at nighttime. That's what's wrapping your final look at weather at sunrise. I'm Godfrey Burnside. Back to you, Star.
Thank you, Godfrey. September is Sickle Cell Awareness Month here in the Bahamas and around the world. It is a time to provide education about sickle cell disease, to highlight the need for research, and discuss the treatment of sickle cell disease. Here to talk with us about this, we're very happy to welcome Dr. SinQuee Brown, who is a pediatric hematologist-oncologist. Good morning and welcome to Bahamas at Sunrise, Dr. SinQuee Brown.
Good morning, and thank you very much for the invitation. It's always a pleasure to talk about sickle cell.
It's always a pleasure to learn more. And certainly this is one of those diseases that we ought to be aware of, particularly as a nation with people of color, where the majority of us can trace our lineage back to Africa in some sense. And apparently that has something to do with this disease. So we'll learn more about that this morning. But let's get started with the very beginning. What is sickle cell disease?
So sickle cell disease, as you have rightfully mentioned, is a condition. It is genetic, it is passed on in families, it is passed on genes. And, it's not a disease that you can catch. I can't catch sickle cell disease by somebody touching me. But definitely if your family has the gene, then that gene can be passed on, just like how the color of your skin is something that is, I think that if you were born Chinese and didn't have a Chinese parent, that'd be a problem, right? So you can't get sickle cell disease without somebody having the gene. And not only somebody having the gene, but the gene has to come from both parents, okay? And there is a situation wherein the gene can be one abnormal sickle gene and another abnormal gene. So you need two abnormal genes coming from the parents that will allow you to develop the disease and symptoms from the disease. Now, if you only inherit one gene though, which can happen, and I think you will be aware of the condition called sickle cell trait. So sickle cell trait is only one gene. Sickle cell disease is one sickle cell gene and another abnormal gene. And that other abnormal gene could be another sickle cell gene. And that is by far the commonest type, SS disease. But you probably be aware of the other types, SC disease, SO Arab disease, X beta thalassemia disease. So, you have several different types, but by far the commonest type is SS, followed by SC disease. And this,
I've never heard about the other types, so I'm happy that you're bringing us that awareness this morning, that it doesn't, I've always heard that it came from the two sickle cell genes, but now we're learning that no, it's sickle cell and an abnormal one can create some other sorts of sickle cell diseases as well. So that's very interesting. Would the symptoms be the same for each of those different types of sickle cell?
So I'm going to mention that in a second. And I just wanted to say that this affects the blood. It's a condition that affects the blood. And the thing that starts out with the problem is one single small change in the molecular structure. All right. So they have the genes have lots of different points and targets there that come together to make you who you are. Okay. And so just one small change the structure of the hemoglobin, which is the protein that carries oxygen in the blood. And this is what causes all the problem and causes the blood to sickle or to change shape and have problems with navigating through the blood pipes, and also to put itself up for destruction. Now, you asked me about the different types of sickle cell disease. These types, there's a little bit of variation. So the SS type is by far the commonest that I mentioned. And those patients are the ones that present with anemia and jaundice. The ones had a SC disease and S beta thal plus disease. Those patients tend to have milder disease, milder presentation, and oftentimes will not even have much crisis. They have higher hemoglobin. So those patients don't get into as much trouble for the pain. So S beta thal 0, those patients, those are the ones that probably more commonly seen.
How do we treat it? Is it a death sentence, or is there a way for us to manage effectively?
So no death sentence, okay? However, there are problems with sickle cell disease. You have a situation wherein they are at risk for infection, and these infections can kill them. And, patients with sickle cell disease, the spleen, the organ on the left side of the top side of your body, that doesn't work so good. And so if they get certain organisms like pneumococcal disease, and we vaccinate against this now. So that is to which we also give antibiotics. And so you probably know that a lot of the sickle cell patients that you are aware of, in the early years, up to about at least 5, we would give them penicillin prophylaxis. In other words, we give them antibiotics, and we usually start out with amoxil in the earlier time because it tastes a little bit better. And then I switch to penicillin tablets, and we give that to them twice a day, every day, for about 5 years minimum, and sometimes we might go beyond that. And so that is what we use, plus the vaccine, which we promote. And these vaccines are the routine vaccines that we give to all children now anyhow, because young children are at risk for this, even if they don't have sickle cell disease. But for the sickle cell disease in particular, we want to give them the routine vaccines, plus at around the age of 2, we give them another extra boost of pneumococcal vaccine that the regular population doesn't get. And this is to protect them from infection. So you can think then if they are at risk for infection, then if they get the infection, they could die. So that is one of the things that we have to attend to. So we want them to get the vaccine, we want them to get the antibiotic, and we want to teach them if you have fever, you bring them in early. The other problem that can kill sickle cell patients is the spleen. Just like how the spleen don't protect them so well from infection, it also can be a source of collecting their blood. So they can have like an internal hemorrhage, they can present in shock, and that is the next big thing that kills sickle cell patients in the early years of life. So, but as you get older, there are other organs that can get damaged in sickle cell disease. You can have problems with the lungs, you can get strokes, you can get issues with kidneys. And so the overall survival for sickle cell patients is less than the normal population, but definitely I would not say this is a death sentence, no.
Okay. Now, how do we screen for sickle cell? I'm in the position of being fortunate enough to have medical insurance. So both of my kids were screened. I also know that I carried the trait. So it was intentional for me to make sure that they were okay. But do we do that for every baby? How do parents maybe identify early on what is happening? Let me know about that, please.
Okay, so I am happy to know that you know your sickle cell status. And in fact, just like how they talk about know your status for HIV, which we could go and do a campaign that says know your status for sickle cell disease. Mm-hmm. Because if we did that and everybody knew their status, then that is information you can exchange with your partner. Mm-hmm. And granted, you may not be able to know the ones that have the extra other genes that I mentioned in the beginning. So we won't necessarily know who has the C gene and who has the beta thalassemia gene. But if you have sickle cell trait, then what I would suggest that you should probably ask for your partner to be screened by a more detailed test than just a sickle cell prep, which is a quick test that they can do HB electrophoresis, which is what confirmed that you only have the trait. So this is a confirmatory test. And normally, unless it is important, it probably would not go to the next step to find out whether or not you carry the other gene. But I think for persons like yourself who carry the trait, then you probably would be wise to know what your partner has so that you know the risk of getting sickle cell disease. Because if you have an abnormal gene, your partner has the abnormal gene, there's a 1 in 4 chance with each pregnancy that a baby can be born with sickle cell disease. Mm-hmm. 1 in 4 chance. And it doesn't mean that if you have one child with sickle cell disease, the next 3 pregnancies won't. Mm-hmm. Pregnancy is the same risk, 1 in 4. So, you want to do that screening test. You asked about screening. So in the private sector, they screen for not only sickle cell disease, but for other things. And I think persons on the, watching this show will know that their babies got a heel prick. Mm-hmm. This was able to pick up lots of things that they're screening for. Sickle cell disease happens to be one of them. Mm-hmm. Unfortunately, this is not what we can do in the public sector because it costs some money. And I think it might be up to $150 or $200. So that's a lot of money to pay. Mm-hmm. So what we do though is that at around the age of 1, we test for anemia and we also screen for sickle cell at that time. We do the sickle cell prep. So there's another opportunity to pick it up. It would be nice though if we could pick it up from as early as after the baby is born, because then we can start with the counseling, the education, and the things that you talked about that or asked about that would prevent complications from sickle cell disease. Yeah. By the way, when I asked you to test your partner, I want you to test your partner before you fall in love. Before you have a child, so that at least you will have an opportunity to talk about it and decide what you're going to do with regards to pregnancy. So, you know, I tell my sickle cell patients that, because if they have two S's, then not only
It's a challenge.
higher for them to have a child with sickle cell disease if the partner has any abnormal trait. And I teach them this from their early teens. But after the love setting, you know, the baby comes and they forget about what I tell them, you know. But anyhow, it is.
Well, Dr. SinQuee Brown, thank you so much for coming on the show this morning and explaining all of this to us. This is so important that we continue to educate our people about this, given that it is so prevalent amongst us. And so we're just grateful that you joined us this morning on Bahamas at Sunrise.
Oh, thank you very much. You have a great day, and let's hope we have less painful crisis, less complication, less deaths in the early infancy period. And if you do have sickle cell, you know, let's talk about it.
Indeed. You're watching Bahamas at Sunrise. We'll be right back.
One thing, two things, little thing, old things, things that are small, things that are grand, things that fit just right, and in the palm of your hand. Fox Hill Nursery, a large selection of garden supplies. If you can see it in your mind, you can find it at Fox Hill Nursery.
The sports we play depend on the health we build. So let's stay healthy. Wear a mask and practice social distancing and hand washing to protect yourself and others. Remember, COVID-19 is not a game.
A public service message from the Bahamas Olympic Committee.
Partner up with the Bahamas as we recreate our islands in the form of a pavilion, showcasing everything our country has to offer, from culinary arts and storytelling to business investments and sustainability. Connect with the world, tell our country's story, explore our future possibilities, and help us transform the Bahamas.
Welcome back to the show. We now have an interview with Rupert Pinder, economist, University of Bahamas professor. Rupert, it's been a long time, I think, since I've done an interview with you, but a lot has happened.
Yes, indeed, Simon. Yeah, yes, indeed, Philip.
A lot has happened. So here we find ourselves again after another general election, and the country's sovereign ratings have been downgraded to BA3 from BA2, which simply means we're now further into junk status once again.
Yep, I mean, there's no question about that. I mean, and, you know, I guess one of the questions that I had was really to the extent of what does this all really means? And certainly when you look in terms of the overall downgrade, it means that obviously, you know, there's a reduction in terms of our creditworthiness, and that obviously has other knock-on effects in terms of high interest rate costs. Also, it means that we have to pay out more in terms of servicing our debt, right? That obviously would impact. And, you know, one of the questions that I had was really in terms of how does it impact the small man on the street, right? And one of the things here is that when you're paying out more in terms of interest rate costs, right, what it really means here is that there's less resources available for healthcare, education, and some of the essential services that are so paramount in terms of growth of your economy.
You know, at the end of the day, we really kind of have to take it to the street level, right? You know, you hear downgrades, you hear Moody's, you hear, you know, ratings and, you know, all of the different letters and the acronyms, but what does it really mean? You started to touch on it a second ago, but what does it really mean, you know, for everyday people? What's the impact of, you know, these credit ratings on how I live every day?
Well, you know, and, you know, as I said before, I started, you know, we started to touch on it a bit. And when you look at it in terms of, let's say, in terms of the economy of the country, it is in a way, there's some parallels in terms of the individual, right? When it comes to individual sort of finances. And basically what is happening here is that the better your credit rating, the lower your interest rate costs and the better the banks treat you, right? That is no different in a way in terms of what happens at a country or a macro level, right? So for example, you know, we've lost a huge chunk of the economy following COVID and of course during, I think it was like overall, I think the estimates are somewhere between 18 and 20% of GDP or the overall income of the economy has been knocked off. And so what happens here is that the better your credit worthy, the more favorable the banks treat you, which means that you have lower interest rate costs. It means that more or less they're begging you to come and get money, et cetera, right? They treat you better. When your credit worthiness starts to deteriorate, it means that it's more difficult for you to get access to money. What it also means here is that you now have to pay out more in terms of interest rate costs. So for example, let's say in terms of an individual, if an individual, let's say, is earning $1,000 per month, and let's assume for argument's sake, for simplicity, pays out $500 a month in terms of loans, eh? Now, what happens here is that if he's in very good standing with his bank, let's assume that same payment is $300, versus let's say if he's in not so good standing with his bank and the payment is in terms of $700 per month. What it means is that this additional $200 is now not available to him to do some of the other things that he would like to do. And it's no different in terms of at a country level.
So then what do we say then? Are there specific resources that we as a country should be tapping into to potentially mitigate against this loss? And how do we turn this around?
Well, I mean, you know, the good thing about it here is that, I mean, there's several, I think there's several tools at our disposal, right? One of the things, obviously, is that I think we have to introduce in terms of this whole issue of tax reform. I think we have to look essentially in terms of our tax base. And, you know, obviously, you know, you want to break it, you know, try to break it down as best as you can, right? But one of the things here is that when we look in terms of, hey, look how we can increase our revenues and at the same time grow the economy, you cannot come back to the same, you have to be careful in terms of coming back to the same well to draw water, meaning that a lot of our taxes really comes from the places at the lower end of the spectrum, because it's really a consumption-based tax. And so I think we have to be a bit more creative in terms of how do we get those persons who have the ability to pay a bit more. And obviously, you know, you're looking in terms of enforcement, in terms of some of the taxes that are on the books, in terms of how you collect that. And at the same time too, I think you also have what I would consider this dichotomy within your economy, to the extent to which you give, you know, there's a lot that is given away by way of concession to the foreign direct investor that in some cases is not necessarily afforded to persons who are investing domestically. And I think we need to be sensible in terms of some of the concessions that we give. Clearly, to the extent to which that you have had downgrades within your economy, I think that also affects potentially the rate of return that some of these investors can get in terms of investing in your country, because it's also what is known as a country risk. But of course, we don't want to get into that, because I mean, that this segment doesn't allow to really expand on that. But, you know, I think a lot of things has to be on the table as we look at ways in terms of how we address, in terms of where we are today.
All right, Rupert, listen, thank you so much. Always a pleasure having you here on Bahamas at Sunrise. What advice, finally, do you give to just regular, everyday working Bahamians?
Well, one of the things here is that, and this is something, I think I've been kind of passionate about, and that is learn as much as you can, right? Because that is how, and I think one of the things here is learn as much as you can. And at the same time too, I think, and I've given it some thought, I think we need to go beyond our individual interests, but and while this may sound pretty much like a cliche, I think we need to start thinking more nationalistically. I think we need to start thinking about the interests of the country rather than our own selfish, narrow interests.
Yeah. Well, we're going to pray on that one. Rupert, thank you so much for always being available to us here on Bahamas at Sunrise.
Yeah.
All right, you're watching Bahamas at Sunrise. We'll be right back.
Have you heard about Trinity Christian Schools?
We are a family school located on Trinity Way, Stapleton Gardens. We offer quality Christian education from preschool to grade 6. Here are the reasons why you should choose Trinity Christian Schools.
We offer quality Christian education.
We are a family school.
Our teachers provide individual support.
Our class sizes are small.
We offer a safe and happy environment.
Our teachers are caring and experienced.
Join the Trinity family.
We want you to be a part of the Trinity Christian Schools.
Come join us.
We want you to be a part of our family.
Here's to all the early morning breakfasts, to the last minute surprises, and a new friend for life. The year the sparks flew and we said, I do. Here's to the biggest table on the street when family and friends come together. Milo Butler, your neighborhood store, a family tradition.
Well, folks, thank you so much for tuning in to today's episode of Bahamas at Sunrise. We hope you enjoyed the show as much as we enjoyed bringing it to you, and that you're looking forward to a great week.
Absolutely, always a pleasure, Star. And in fact, I am looking forward to the week. I'm looking forward to being very productive.
That's good to hear, Phil. That's good to hear. Stay productive, Phil. It keeps you going. Well, we wish you guys a great one. We'll be back with more on Friday. Be safe.
Yep, be safe. See you soon. Bye.